generally defer to the folks on the list. In this particular case, one who signed up early, actually, and that is to the General Assembly representatives. Delegate Kathy Byron is here, and I would ask Joe when he starts off, if he'll give you an idea of how we're going to proceed. But Delegate Byron will be the first speaker, and then we'll go down the rest of the list. Please understand that in order to make sure that we can move through this 1 hour as quickly as we can, Joe will be calling the name of the speaker and then the next speaker on the list as on deck, so that you won't have to walk so far to get to the podium. So he will be calling 2 names at that point in time. So I will ask Joe to begin with Delegate Byron and call the next individual on deck.
Thank you, Mr. Chairman.
Byron, and I'm a resident of Campbell County and a member of the House of Delegates representing the 22nd District. I am also the patron of the amendment to Senate Bill 924 that required this board promulgate the regulations under consideration today. The debate over this legislation as amended in both houses of the General Assembly was extensive. That discussion was emphatically clear and unmistakable. It was about setting and enforcing appropriate safety and health standards and regulations that would apply to every facility, current or future, that performs abortions. Any suggestion that the legislative intent in approving this measure was to allow the exemption of an existing facility or any facility is false and wholly without merit. Members who voted in favor of this legislation did so to ensure the safety, health, and well-being of those women who seek medical services from these facilities. This legislation secured support from legislators of both parties in both chambers of the General Assembly. On final passage, it was approved by a House under the control of one party and a Senate under the control of another. There was nothing vague or undetermined about the legislative intent of the measure or about the implications of its passage. I urge this board to fulfill its duty on this matter by approving regulations today that reflect the intent of the duly elected public officials who voted to enact this law. I want to thank you for allowing me to speak to you today, Commissioner Remley, Chairman Edwards, and board members, and the opportunity to speak and the necessity to leave for another meeting. Thank you very much.
Thank you very much.
Good morning. I believe I offer a very unique experience on this issue for several reasons. First and foremost, I'm a post-abortive woman, twice. This is the first time I've ever spoken publicly about it, and yet you bet I'm ashamed and embarrassed to admit the truth. But I couldn't hide it anymore. I couldn't be silent any longer. You see, I know firsthand the intimate details of what it feels like to undergo a medical procedure to abort a child in the womb. That was over 30 years ago. I can assure you that the last thing on my mind when I walked into that abortion clinic was safety standards. I just prayed that they wouldn't hurt me. Ashamed and humiliated, I walked with my head down, not wanting to make eye contact with anybody, more or less, or much less looking around to see if there was a safety and sterile environment taking place. Even if it was unsafe or something went wrong, who was I going to tell or report a problem to? This was my big secret and no one would find out. I moved on with my life and I strained forward. I became a strong pro-choice advocate and spent many years trying to protect women's reproductive rights. At times, I was even militant. I was a radical feminist. Inside me was angrily arguing the issue. I even lobbied lawmakers in the General Assembly, and in fact, I was ready to accept a board position on the Virginia League of Planned Parenthood. Well, that was then, and this is now, and I'm no longer comfortable fighting against life. I'm here today because I must stand up and fight for the safety of women in the Commonwealth. As I wrap up my testimony, I offer a very basic question to this board. If you are truly committed to the health and safety of women in Virginia, doesn't it make common sense that you will choose to do everything in your power to provide the highest safety standards available? Thank you for your time. And by the way, I am not my abortion. I am Leslie. I am a woman. I'm a wife. I'm a mother. I'm a daughter, a sister, and a friend. and I am a passionate pro-life supporter.
Thank you so much.
Thank you.
Good word. I advocate for and educate on awareness for a very visible segment of our society, and that's our active duty service members. These service members, however, have very invisible wounds, traumatic brain injury, and post-traumatic stress. I know that I cannot be with them when they're in fear. I cannot stop the IEDs from exploding, and I can't hold their hand when they're lying wounded and afraid. But what I can do now is make sure these wounded warriors are protected while they heal. I can make sure that the people who care for them are qualified, trained, and have background checks. I can make sure that their rooms meet local and state building codes. I can also make sure that everything is clean and protect their already compromised bodies from infection, illness, and death by neglect. I can make sure that the drugs they need for healing, headaches, nightmares, and pain are properly accounted for and administered. What I can also do today is advocate for all the invisible women who have lost their lives in botched abortions. I couldn't be with them while they were lying on the abortionist table, and I couldn't hold their hands while they were lying wounded and afraid. But I could be here today and speak to those who will never, ever have a voice again. And I ask you today, I implore you, please protect these women. If they could speak today, could you ever imagine that they would be sitting here supporting fewer safety regulations? I'm Dr. Kirsten Ball, and I have private practice in Arlington, Virginia, and I'm very concerned about the safety of women who enter abortion facilities in our community. If you or your daughter goes to our outpatient surgical center or assisted station or lumpectomy, you'll find that places clean as good infection control, toilets are sterile, there's good medical practice there. If you or your daughter enter a medical or an abortion facility, you won't necessarily find such great standards. I have done searches on a number of the physicians who perform abortions in the state, and a lot of them have had their licenses suspended at some point or other, or otherwise been disciplined for their medical incompetence. And these men and women have women's lives in their hands. Right? On July 20th, the woman that was mentioned in the last talk entered a Planned Parenthood facility. During the course of her abortion, her uterus was lacerated, her left broad ligament was perforated, her left uterine artery was severed, and according to her autopsy report, there was a liter and a half of blood in her uterine cavity, her abdominal cavity, and she was finally, after 5 hours of lying there on the table, finally taken by emergency medical services to the local hospital. And this is not an isolated incident. As you know, women are frequently injured and sometimes they die as a result of the procedures. And, I have a question. If the abortion facilities in this state are really well run, if they have good medical practices, they have good infection control, then what are they worried about? What is their fear from regulations that are not safe and should they be regulated or developed? Thank you.
Nova Women's Healthcare in Fairfax kills the largest number of babies, and that's where all the sidewalk counts are. They killed over 3,500 in 2011. Nova Women's Healthcare has a long history of abortion injuries and standard of care violations, including the death of a patient in 2002. Its owner, Myung Kim, continues to operate the abortion clinic even though she was forced to surrender her license in 2007. In 2005, Kim was disciplined after a patient in 2002 died from an air embolism during an abortion. Kim improperly sedated her patient, failing to realize that she had gone into cardiac arrest. Kim did not attempt to resuscitate her. In 2007, the board determined Kim failed to provide follow-up care for her patients, kept inadequate records, and improperly dispensed and handled drugs. Under threat of revocation, Kim voluntarily surrendered her medical license but continued to operate her abortion clinic. In 2009, Kim and Nova Women's Healthcare was sued for conducting an abortion on a woman with an ectopic pregnancy. The patient was told the abortion was successful and sent home. The ectopic pregnancy later ruptured and caused a painful and life-threatening emergency for the woman. There can be no doubt that King's policies and procedures for which she was forced to surrender her medical license are in place at NOVA and are endangering the life and health of women every day. These regs are the least Virginia can have in place to rest women to safety after a botched abortion. Please vote for these regulations. They protect women, even though these butchers, baby killers, are killing babies.
President of the Family Foundation of Virginia. On behalf of thousands of Virginians who could not be here today, we urge you to amend the abortion center regulations to include building standards. For over a decade, the abortion industry has claimed no regulation is necessary because their facilities are safe. It fought against legislation that simply required licensure, inspection, and emergency equipment. Now we know why. The discovery of widespread violations of health and safety in recent inspections from the emergency regulations. The inspections the industry fought so hard to stop reveal that the industry has no credibility when it comes to what regulations are necessary and which are not. Department of Health records show a minimum of 80 violations in simply 9 clinics, and more inspections have been done since, including a bloody procedure table that wasn't sanitized between patients, multiple incidences of failing to sanitize equipment properly, untrained staff, and a lack of oversight of drugs. These reports indicate widespread disregard for patient safety. An industry that has covered up these kind of problems for 2 decades does not deserve to be listened to about when and how it should be regulated. The women of Virginia deserve better. They deserve to be treated with dignity, and bloody patient tables, unsanitized equipment, untrained staff, and basic disregard for medical protocols does not indicate concern for women. Those who have stated in the past and today that the health and safety standards are unnecessary have claimed that medical science is on their side. The inspection reports reveal that they do not have any science on their side. Instead, they were able to hide behind a politically motivated veil of secrecy for far too long. Now we know the truth. The abortion industry has proven unworthy and untrustworthy. It is up to you to see through the deception and amend the regulations to ensure that they meet the demands of the legislature and to ensure the safety of women. Thank you.
Thank you. Next speaker is Julia Hewitt. On deck is Leslie Rubio.
Mr. Chairman and members of the Virginia Board of Health, my name is Julia Hewitt. Thank you for allowing us to speak today. I represent the Family Research Council, a public policy organization that defends human life and religious freedom and represents thousands of constituents across the country. I myself reside in the state of Virginia. FRC supports enhanced abortion clinic regulations and asks the board to adopt regulations consistent with the statute passed by the Virginia Assembly last year. We believe these regulations must include appropriate building standards for abortion clinics. Some may argue that regulations are not necessary, but the fact remains. Abortion is one of the least regulated surgical procedures in the United States. It often results in unsanitary and unsafe conditions. Recent Freedom of Information Act audits revealed that after inspections of abortion clinics took place, as mandated by the emergency regulations, at least 9 clinics had eliminated violations. Regardless of one's belief regarding abortion, each woman deserves to know that an abortion clinic is as safe and as regulated as a beauty salon or veterinary clinic. Right now, not every woman seeking an abortion can have this confidence. The regulations considered today would require abortion clinics to conform to the same safety standards for other similarly situated healthcare facilities. This is eminently reasonable and completely constitutional. Even in Roe v. Wade, the U.S. Supreme Court recognized that the state has a legitimate interest in seeing to it that abortion, like any other medical procedure, is performed under circumstances that ensure maximum safety for the patient. FRC supports such regulations and urges the board to adhere to the requirements of the law as passed by the Assembly and as described by Attorney General Fitzgerald.
Contact Barbara to Dr. Stephen Dunham.
Good morning. Thank you for letting me speak. My name is Stephen Denham. I'm a practicing OBGYN here in Richmond. I represent not only my practice of 22 OBGYNs, but also the Virginia section of the American Congress of Physicians Gynecologists. I had the privilege of speaking before this board back in June and appreciated the fact that this is a very difficult issue, and there's honorable and good people on both sides and have divergent views on this very difficult subject. ACOG is neither pro-abortion nor anti-abortion. We are advocates for women's health and safety. We believe that as long as termination of pregnancy is a legal option, it should be safe and accessible for all women. I had other prepared topics, but I want to rebut some of the things that were said earlier today. No one believes that abortion clinics should be unregulated. We as physicians believe that there absolutely should be safe options for women. Our concern is really only about the building codes for existing clinics, because in our opinion, it does not limit inspection, it does not limit care or monitoring or regulations regarding monitoring of patients. What it does is it puts it's onerous for these clinics sometimes to pay the amount of money that's required for these clinics to retrofit to become facilities have the same regulations as hospitals. They will therefore potentially close clinics, make it difficult for women to get safe care. And then the only alternative will be illegal care or the quote-unquote back-out abortions. Now, I never had to take care of these women because since I've been practicing for over 20 years, abortion has been safe, legal and safe. From my professors, people I've trained with, we saw these patients back before Roe v. Wade, when it came on, tell horror stories of patients who showed up a week, not just once a week or once a month, but day after day, the emergency room with complications. I would only like to say, once again, we do not believe that they should be unregulated, but the building regulations, building code, we think were fine from the amended document back in June. Thank you for listening.
Thank you.
Good afternoon, Board. It's really simple from what you've heard from these doctors just now. The architectural requirements in this bill will shut down over half the clinics in the state. And to take away women's access to necessary services like STD screenings, cancer checks, birth control, and yes, abortion. By taking these things away from women, it defies the logic to me of the Department of Health and what it exists for. To institute unnecessary requirements like this that will shut down so many clinics when you can keep them open and you can still regulate them so that they will be safe, as you should. I'd like to share with you now, in the time that I have, some comments that Attorney General Cuccinelli made himself regarding burdensome regulations. At a recent gathering of Richmond Tea Party members, the Attorney General gravely reminded the folks in that room that, quote, "It's always about people." When you have this across-the-board regulatory assault, and again, we're speaking about the burdensome architectural requirements. When you have this across-the-board regulatory assault, the first people hurt, and the people hurt the worst, are the poor. And this is straight from his mouth. I wish he could apply that same logic to this situation here. Because the flip side of that is that rich white women will always have access to safe abortions, whether they're legal or not. The voices missing here today are those of the single mothers that are holding down 2 or 3 jobs that couldn't be here today. They're doing that just to take care of the family that they already have. People like me who can afford to take a day off of work without pay to be here are not the voices you should be hearing from. I urge you to remember their voices and to please grandfather in existing clinics so that they don't shut down, so that they remain open, and you can regulate them as you see fit while they're still open. Thank you.
In my opinion, as a health professional, I'm not looking to proceed with operations. Much for letting me speak. I was struck listening to Dr. Remley's talk because in her talk earlier, she mentioned data and medical evidence several times. I've been a physician in Virginia for 40 years, and the whole Commonwealth holds this board with the utmost respect. And I am concerned that the process is somewhat being affected by political events. And what I would like to say is this. Last time the board took a vote, the vote was 7-2, and as you as a board have been instructed, go out, seek medical evidence. You've had a board of experts. They made recommendations to you. Last time, you voted 7-4 based on those recommendations and not politics. So I ask you today, please, for the reputation and the integrity of this board as we go forward, all I ask, put politics aside, use your resources of medical evidence to make your decisions. That's all anybody asks of this board to date, as Dr. Remley did just a few minutes ago, gave reports on what what was based on medical evidence to go forward, and I commend you and thank you for the service.
Sir, could you restate your name for the record?
Kenneth Olshansky. Thank you.
Thank you for meeting with this morning and letting us have this time to speak. And I'd also like to defer to Kathy Greener.
You said Kathy.
Here, I'm the director of the Women's Rights Project at the ACLU of Virginia. The Board of Health has been told that its decision on June 15th to grandfather in existing women's health centers was outside the board's authority. Quite simply, that is not true. The Attorney General asserts that the regulations, as amended to allow for grandfathering, are in conflict with Virginia code that states that the board shall issue regulations for healthcare facilities consistent with the current edition of the FGI guidelines. The Attorney General's office is incorrect about the board's obligations under that Virginia code section. That section of the Virginia code, enacted in 2005, has never been interpreted to require existing facilities to meet new construction standards, and a fair reading of its plain text provides no support for such a requirement. In each and every instance that the board has regulated healthcare facilities since that Virginia code section was enacted, it has applied the guidelines only to all construction of new buildings or alterations and additions. The guidelines themselves explicitly state that they are intended as minimum standards for designing and constructing new healthcare facility projects. Thus, the board's refusal to apply the guidelines to existing facilities is, quote, consistent with the guidelines. The Attorney General has the responsibility to review proposed regulations to determine your authority to adopt them. Here, the board has the authority to grandfather in. The board is not bound to follow the Attorney General's advice. Thank you.
Thank you.
My name is Dr. Wendy Klein, and I specialize in the care of women for 25 years. I am deeply committed to excellence in patient care and to the highest standards of patient safety, and I have no doubt whatsoever that every healthcare provider in this room feels the same way. No one here is opposed to oversight and to regulations that improve safety. However, there is strong and understandable opposition to unreasonable regulations that are deemed unwarranted by some of the best medical experts in the Commonwealth. Regulations that would require Virginia's existing abortion clinics to comply with standards for new hospital construction are insidiously designed to limit access into closed clinics. I'm sorry, parking spaces and awnings and hallway widths simply do not improve patient safety. There are years and years worth of health statistics maintained by the Virginia Department of Health that in fact attest to an excellent safety record, not to mention the countless studies done throughout the nation that have validated the remarkable safety of early abortion. It is appalling that the current administration has sidestepped the expertise of a state-appointed medical panel and has manipulated the work of the health professionals on this board. The Board of Health is an independent, objective, public health advisory group that is supposed to act with impartiality in weighing scientific evidence. Its core mission is to improve access to care. How can the board do that if political influence trumps not only evidence-based medicine, but also the rights and the best interests of the women of Virginia? I really, we're not talking about sterilization. We all agree that oversight is needed. We're talking about unreasonable architectural improvements.
Thank you.
This is not about the safety of abortion clinics. This is about stopping abortions. I ask you to continue exempting existing clinics from new architectural standards. The State Board of Health's mission statement reads, the board serves as the primary advocate and representative of the citizens of the Commonwealth in achieving optimal health. The board identified the citizens of the Commonwealth as its primary customer. The governor's office and the legislature are secondary customers. Therefore, I would surmise in this issue the women of Virginia are your primary concern, not the political machinations of Tim Puccinelli and the General Assembly. This board has stated priority health issues to be addressed include the improvement in the health and well-being of all Virginians. When there is no proven medical or scientific basis for a change in regulations or is detrimental to the well-being of some citizens, there should be no change. This board states that we utilize numerous approaches to achieve those priorities, including supporting improved access to preventative and primary care services. There are no medical reasons for these architectural changes and do in fact make access to medical services either impossible or at the very least more onerous. Many facilities that perform abortions also offer health screenings, birth control, and other gynecological care. This board has cited as one of its core functions advancing quality of life through improved health. Denying access to medical care by forcing the closure of medically appropriate clinics does nothing to advance health care. Code of Virginia states that the state board of health shall administer and provide a comprehensive program of preventative, curative, restorative, and environmental health services. How can this abomination before you improve women's health to me is a mystery. The Attorney General's office has said that this board has exceeded its authority. I submit that this section of the code, 32.1-2, directs the board to protect women's health rights, not hinder them. There is no basis for treating a plaintiff that performs more than 4 first trimester abortions monthly at a hospital unless all clinics, medical, and dental offices that perform surgical procedures are treated equally. If the law
Thank you very much.
Thank you.
Next speaker is, I have no idea whether what I say will be endorsed by my employer, so I caution against such presumption. I'm here to offer 3 points administratively. The first is that Virginia law leaves your clinic with the discretion to grandfather existing clinics. In section 32.1-12, the General Assembly has delegated to your board power to make regulations for public health and safety, as well as the power to make exceptions when you find them reasonable and necessary. But the General Assembly gives and can take away. Chapter 670 clearly deprived you of the power to exclude abortion clinics from regulation as hospitals. But what the General Assembly did not take away in Chapter 670 remains, and that is this board's discretion to grandfather existing clinics as it has grandfathered existing facilities of other hospital sorts in the past. The General Assembly might have explicitly prohibited grandfathering or specified that existing facilities be treated as the same as those yet unbuilt by the board. The Attorney General may not coerce you by threatening to abandon you in court. That would allow him in practical effect when he admits the law refuses him, the veto over your regulations. Should your decision come under attack, you should call upon him for your defense. According to section 2.2507, all legal advice, all legal service in civil matters for your board shall be furnished by the Attorney General. He is excused only when defending you would be impracticable or uneconomical. That he disagrees with you does not make defending you either impracticable or uneconomical. In the rare instance when the Attorney General is unable to defend you, the Governor can find you replacement counsel. But the Attorney General's disagreement with your legal position hardly makes him unable to defend you. Thank you.
Thank you.
I just strongly believe in a woman's right to control and reproductive life. I know the first semester is abortions are one of the safest procedures, and that the decision to regulate was targeted by the legislation, targeted by legislation on abortion clinics, and if your job is to promulgate regulations on instruction. I was here in June when you did just that, appropriately, in keeping with precedents and all other medical facilities in the state, grandfathering in existing clinics, exempting them from this extremely cost-prohibitive construction code that clearly states that it's only intended for new construction. And I thank you. I thank you for making an evidence-based decision, respecting your own expertise and position, and standing strong when the Attorney General's assistant threatened not to certify. I can only imagine what you've been through since that time. As the Attorney General sat on the regs for a month and refused to certify them, sent them back with the help of the Governor back to you, despite him not having veto power. The disrespect of the removal of your motion to grandfather prior to coming back to you now. And now him threatening you all legally and refusing to fulfill his duty in representing you. Ironically, I just watched a PSA by the Attorney General against bullying. Today is not about abortion. Abortion is legal. It's not about safety. First trimester abortion has been safe and now is regulated, and most clinics have been through their first inspection and are now licensed. This is political and ideological and about the agency's intent to close clinics. There's no place for that in evidence-based decisions. The Attorney General is who has overstepped his authority. Please stand strong, fulfilling your mission. Regulate clinics, but don't close them. Thank you. I'm Andy Gannon.
As she's coming up here, I would just like to say that there are 200 plus people outside, 70% of which are in support of the grandfather clause. We're going to be documenting that. I want to know that.
Thank you to the board members, especially those who voted for grandfather amendment at the June meeting. I know that took a lot of courage. The board members who believe so strongly in a pro-life position that nothing I say today can make a difference, not statistics, logic, safety-based facts, and certainly not separation of church and state. But to them, I say that Dr. Seeds, the Attorney General's, and the Family Foundation's view of God is different than what most other people in this world believe. I believe in a God that knows the challenges we face as human beings are complex and difficult, but He loves us and respects us to make those choices. I read that Soviet Russia used onerous architectural regulations to shut down churches to prevent people from practicing their religion. I think that there are people in the room who can't see the similarity between what's occurring now and what happened there, but there are enough of us in the room who do. To the non-ideologues on the board, if the grandfather amendment is not passed today, it will be the first time existing structures are not grandfathered. We have heard that you will break the law if you amend, and the AG's decree, but if the board is sued, he will only represent those who voted for regs as he wants them. Thank you to John Paul Jones for debunking that. 2 points. If I had to choose legal advice, I think I would choose to believe John Paul Jones and the ACLU over the guy who goes around suing research scientists. Point 2, there are many in this room who would help support your defense funds.
Thank you very much. We appreciate it. Could you please restate your name for the record?
Elizabeth Musselman.
Thank you very much. Next, take your sign, please. We're sharing signs. Also, please, if you're in the room and you're not speaking, please remain in your seats.
Next speaker is Camille Rudney, and on deck is Shelley Abrams.
As a therapist, I have human beings walking into my office every day and sharing their most intimate experiences with me. I walk into that room with all my very human biases, prejudices, political opinions, and that space is sacred for me. And I put those aside. I work really hard to put those aside when a client sits in a chair across from me. We're people who work with people, with individuals who come to us when they're vulnerable, sick, scared. We've gone through years of schooling, mentoring, researching, residencies, to be able to do what we do well and to be able to do it with integrity. If the Attorney General walked into my office and told me how to help somebody heal from trauma, how to cope with panic attacks, I'd be furious. If he hauled me in for meetings with his lackeys and sent me thinly veiled threats in his memos, I'd be scared. But I would not let him bully me into harming my clients. I would say no. And I'm asking you to keep this space, this room, a sacred space, and keep the grandfather clause. Thank you.
Thank you.
Next speaker is Shelley Abrams. On deck is Abby Truskin.
Is that your sign too? Who does that sign belong to?
I'm Shelley Abrams, and I run a local area abortion clinic. I've seen all the nasty political maneuverings that have gone on since the last meeting. You all have been threatened by the Attorney General. You've been given long talks by Matt Cobb, whose wife spoke earlier from the Family Foundation. The governor has appointed Dr. John Seeds here to push his and the governor's anti-abortion agenda today. You are now at risk of being part of the conspiracy to effectively outlaw abortion in Virginia, against the wishes of the women of this Commonwealth, against the law of the land as set out by the Supreme Court, and against your mandate as members of this board to ensure the health and safety of all citizens. To be part of this perversion of your mandate is to put a stain on all of your efforts and the record you will leave for the future. My clinic is now fully licensed. We've done absolutely everything you have asked us to do. The only thing we have not done is rebuild our entire facility. If these requirements are so important to women's health, how can I be given 2 whole years to comply with them? The architectural requirements exist for one reason and one reason only, and that is to create a cost barrier to clinics who wish to stay open. Everyone here knows that. Dr. Seeds knows it, which is why he will push strongly to keep the grandfather clause out of the regulations today. You know in your hearts that you are being strong-armed, and you know it is wrong. Vote to reinstate the grandfather clause and stand up to the tyrants who are bullying you. Thank you for your courage.
Thank you.
To Jules Irwin Rooney with the ACO employees, I also urge you to grandfather. Thank you.
Could you state your name for the record, please?
Abby Gessler.
No, we have
Jules
yours.
Irvin Rooney. May I have my time back since I...
Yes,
Thank
we'll
you.
restart that.
My name is Jules Irvin Rooney. I'm a legal intern at the Women's Rights Project at the ACLU of Virginia. First of all, no court has ruled that regulations such as these are constitutional. These would be the most onerous in the nation. Secondly, you have a constitutional obligation to not impose unnecessary regulations. The Board of Health was within its authority to grandfather in existing women's health centers. Virginia law directs the Board of Health to create regulations for healthcare facilities that conform to standards established by medical and health professionals. The original draft of regulations for women's health centers did not conform to the statute's purpose. Instead of imposing requirements that only for new construction on existing facilities contradicted what medical and health professionals and specialists recommended. In fact, the specialists who authorized the guidelines for design and construction of healthcare facilities themselves stated that the guidelines are intended to apply only to new construction, not to existing facilities. Additionally, the Virginia Department of Health's very own panel of medical experts asserted that existing facilities should be grandfathered in. Thus, it's actually the original draft of regulation for women's health centers that exceeded the board's authority. In amending the regulations to grandfather in existing women's health centers on June 15th, the Board of Health recognized that inconsistency and amended regulations to apply as the experts intended. A state decision to correct this inconsistency should be made today, and it is within the board's authority to do so. The Attorney General's office has given you and the department advice. The office's advice can inform the board's action, but it cannot and should not decide it, especially when, as here, the office admits that their interpretation is inconsistent with every other regulation of healthcare facilities and far from consistent with the laws at issue. Thank you.
And I'm a student physician from Eastern Virginia Medical School in Norfolk. Before beginning my academic medical training, I had the privilege of working for a local independent abortion provider. There are two groups being represented here today. One group is here to tell you how unsafe abortion is. Most of them are here for religious reasons, and the last time I checked, faith in God didn't grant you the ability or skills necessary to understand and interpret scientific medical information. For example, the Family Foundation, either by ineptitude or deceit, has attempted to mislead the public about inspections of abortion clinics that have been given licenses by the health department, by the way. This group obviously has no problem disregarding the Constitution and feeling entitled to impose their religious beliefs on the citizens of Virginia. They also have no problem bullying you, the Board of Health, into doing their bidding through threats and intimidation. I, on the other hand, am here from the other group, the group that understands medical practices and procedures should be determined by what the evidence supports. And what does the evidence say in this case? It says that abortion is 13 times safer than childbirth in the first trimester, that it is one of the safest procedures performed on women worldwide, in this country, and in the state of Virginia. The evidence says that there was no reason for these regulations to begin with because women weren't being harmed by abortion in this state. The evidence says that driving home from this meeting today is far more dangerous than having a first trimester abortion. Limiting access means women wait longer to get abortions and they have to drive further. I am on the side that is on your side, the board's side. We applaud you for doing your job in June, and we know that you acted within your rights. We haven't been bullying you like petulant children. We've been supporting you and thanking you for your fight against corruption and tyranny. And again, I just want to thank the Board of Health for your courage and doing the right thing back in June, and I hope that you have the courage to do it again today. Thank you.
And I've come here to challenge you to bring to hospitals the same level of standards that you wish to impose on abortion clinics. My mother last year was left without medical treatment with her spinal cord injury for 7 days by local hospitals in Northern Virginia. The third time she was brought back, she was left without medical treatment for 31 hours. The radiologist who was supposed to take care of her left home for a holiday weekend with stat orders unmet. She became paraplegic. After this, she was overdosed with medication with steroids for 14 days, 40 times the normal dosage. Rather than taking care of this horror, which was not with even a medical order, she was force-fed antipsychotics, which caused her to have swallowing problems. She had aspiration pneumonia, and they also chose to restrain her. Your inspectors found that she was illegally restrained for a total of 20 days. You chose to do nothing. As a result, she got a pressure ulcer, a stage 3 pressure ulcer. When we finally got her to other care, that improved, but unfortunately she was brought back to this hospital. She was ordered involuntarily starved for a total of 7 days. If you have in your pocket a roll of lifesavers, you have more calories than my mother was given in 7 days. And this was with the knowledge of the doctors, the knowledge of the hospital, and the nurses reported it every 2 hours that she was being starved.
Thank you very much.
She also received a black eye when the inspector came and nobody cared.
Right, formerly on the State Advisory Board.
Could you please restate your name?
Yes, sir. My name is Frida Cathcart. And could you start at 2 minutes, please?
Yes, please start.
Thank you. I served on the State Advisory Board as the consumer representative, and I was stunned to hear that the Attorney General, Ken Cuccinelli, rejected your amendment. This has never happened before. I'm aware of. I asked my state senator, John Edwards, who serves on the Health and Advisory Board, the Senate Health, the State Senate and the Health and Committee. And he said that he has never heard of it happening before in the history of our Commonwealth. And he knows a lot about our history and our Commonwealth. The members of state advisory boards have to sign an oath to uphold the state constitution, including the Virginia Statute of Religious Freedom. Members are appointed for a specific term by the governor to prevent them from being subjected to the politics of the day, so that they can do the work of protecting the people's health through evidence-based decisions. Attorney General Ken Cuccinelli seems unwilling to fulfill the job responsibilities for the office of Attorney General by threatening not to defend the Board of Health's decision to protect women's health care. It is disturbing that there have been reports of behind-the-scenes meetings where members of the board have felt pressure to reject the vote that they made in June. It is not acceptable to play politics with state advisory boards or with women's health care. I'm a descendant of my ancestors fought in the American Revolution. And we've been here since Williamsburg, where my ancestors sat in the House of Burgesses. We are a commonwealth of laws and civility, and the Attorney General overstepped those boundaries today. And we count on you to keep that grandfathered amendment. Thank you.
Thank you.
Will be Keontae Stewart Reed.
Good morning. I traveled here from Nelson County, Virginia, a rural area between Lynchburg and Charlottesville, because I care deeply about the health and safety of the women in my life and in all of the state, and indeed I believe all of our well-being, men and women, is connected to that. I appreciated the suggestion that we defer to experts to speak today with the citizen comment time, but let's be honest, if we're relying on a 1-hour citizen comment time for expert testimony that the Board of Health needs to make this sweeping decision, we're really in trouble today. You've had the science before you. There's ample expert evidence that these regulations are unnecessary, that the grandfather clause is legally and medically okay. I don't know what's happening to us here when this could happen with important decisions that affect public health and safety. Sometimes it's hard to separate yourself from it when you're in the middle of it. The governor and the attorney general are taking tyrannical action to promote a religious right-wing agenda. And just imagine for a second how you would view that if you heard it on the news, that the Attorney General abused his authority and intimidated a government body into promoting a right-wing religiously motivated agenda that restricted the rights of women. I dare say it might be a pretext for us to invade that country and bring democracy to those people. The grandfather clause was the right thing to do before the Attorney General threatened you. It's the right thing to do now. I urge you to have the backbone to stand up for your convictions or to step down from this body if you're unable to do so. Thank you.
Thank you.
The Executive Director of Planned Parenthood Advocates of Virginia. Last year, our affiliate served more than 24,000 women in the Commonwealth with life-saving cancer screenings, birth control, and preventative health care. But today I want to speak with you about the original abortion facility regulations, which were a solution in search of a problem, that apply the FDI guidelines to existing facilities. Application of this section threatens Virginia women's access to health care because of the burdens it imposes on health centers. The Board of Health, this board, has been told that its courageous decision on June 15th to grandfather in existing women's health centers did not fulfill the legislative intent in passing SB 924. This is completely untrue. SB 924 has a much more limited scope than the Attorney General would have you believe. It charged this board with creating minimum standards not only for construction, maintenance, staffing of hospitals and other facilities, but also for policies related to infection prevention, disaster preparedness, and facility security. It also classified abortion providers as hospitals. Thus, the bill did not direct this board to promulgate any regulations directly targeting abortion providers, but instead simply added regulation of abortion facilities like other healthcare facilities. And those FGF guidelines, as we've been told many times, had never been applied to existing facilities. We ask you board members that you please take your courageous stand again and do what you did in June 15th to ensure access to women's health care for all Virginia women and grandfather in existing healthcare facilities. Thank you for your time.
Thank you very